Well, from how you should cook the perfect meal to where to get all the best deals, we have it coming at us from all angles when it's portrayed how we should or could have the perfect holiday. But on top of all of that, caregivers are trying to keep up with the mainstream while putting themselves last in many cases. It can be very depressing. Is there a way to find the balance and the joy? Joining us this morning is Lou Ann Arnson. Good morning. Thanks so much for being here. You know, this is very timely because November kind of is a special month of awareness for caregivers, right?
Yes, yes, it is.
Yeah, explain why this is so important and timely this time of year.
Well, you know, we are bombarded by an awful lot of stimuli telling us how to cook the perfect meal, everything that we should do to have the perfect holiday. And we're led to believe that it should be pretty joyful. And oftentimes some of us are not feeling very joyful. We've got an additional role of being a caregiver. And that produces, with the wonderful stress of having the holiday and the excitement, it also produces a lot of negative stress, which can lead to what we like to call caregiver blues, which can also lead to depression. So, you know, when we think about a caregiver, we often think that maybe they're a person who is older, maybe in their 70s or 80s, and caring for perhaps their loved one, when actually the average caregiver is a female. She's 49.
Oh, wow, so young.
Yes.
Way different than what we were picturing.
Very much so. She works full-time, has a career. She also has a family, and her caregiving role extends beyond. So she is providing up to 36 extra hours of unpaid care to a family member, a child, somebody with developmental disabilities. So it's quite a role.
And when you're saying that, the extra 36 hours, I'm trying to calculate real fast, there aren't many hours left for her, right?
That's correct.
No hours left for her.
That's correct.
So you said it leads to depression, but also at some point it's got to make them sick too, right?
That's exactly true. We're finding that those individuals in a caregiver role, if they have, once a caregiver is gone, they can have pretty complex illnesses up to 3 years after they stop the role.
Wow, 3 years. All right, so you said she's trying to work. Well, if there's something happening with the other person and then your career kind of gets put on the back burner a little bit, how does it affect your career and your other relationships? Say they're married and that sort of thing.
That's exactly what happens. So these are individuals, these are women who are often passed over for promotions because they've got a lot on their plate. And the employers are looking at them, they're far too stressed to be able to do anything more than maybe make it into work. They lose promotions, they lose raises, they often underperform. Maybe they've been a stellar employee up to that point and then they have stopped performing. And so it does take a toll. They also use a good part of their income to provide additional services for their loved one or the person they're caring for, so that is a financial burden as well.
Even if it's just an extra stop at the store here and there, all those things add up. We're not always talking about medicines and that sort of thing. It's just all those extra, the gas, anything else like that. And what you're describing when it comes to their career, it sounds like they're actually probably perfect when it comes to a career role because they're very responsible. But the thing is, the responsibility has to be pushed somewhere else.
Right. It comes with a cost.
Absolutely. What are some of the danger signs that it's more than just the blues and it's a serious depression situation?
We're often looking at someone who has a real lack of joy in life. They tend to become quite isolated. They may stop socializing. They're starting to spend a lot of time with negative thoughts. They may also have some intrusive thoughts of harming themselves, that maybe they'll be better off dead,
Yeah.
that someone else can take over this tremendous burden.
Well, so quick ways we could try to take care of ourselves if we are a caregiver. Drink lots of water. The seeds kind of come into play
Oh,
here, right?
yes.
Drink lots of water. We talked about the seeds down here a lot. So if you want to just run through a couple of those, we have them up on the screen right now too.
Okay. One of the things I think is, and I tell my clients, is to be realistic with yourself. So, you know, make a list and do half of it. Do one or two.
Yeah.
And practice some really good self-care, and that can be whatever brings you joy.
Sure.
That's not adverse. And probably I would look at telling people to really allow yourself to feel that pain.
Sure. Absolutely.
It's real, it's temporary, it will pass.
Yeah.
But if we try and deny it, a lot of times we're going to end up with a lot of guilt and shame.
Right. All right, well, we're going to end it right there. We have a lot of help here in the community, along with Luann and along with Dr. Bittner. I know you guys work all closely together. We have a great unit of women here in West Michigan. To set up an appointment with the Midlife, Menopause, and Sexual Health team at Spectrum Health, make sure to call 616-267-8520. Their offices are located on the west side of Grand Rapids at 3800 Lake Michigan Drive Northwest, Suite A, and then on the east side of Grand Rapids, northeast side, at the Integrated Care Campus, which is right at East Beltline.